Hi, my name is Amanda. I am going to perform a respiratory assessment today uh, on Ashley. How are you doing today? I'm good. Have you had a respiratory assessment done before?
Yes, at my primary care doctor's office.
Do you know what a respiratory assessment is?
I'm guessing to check out my lungs.
So it's a routine assessment that we check for patients, all patients, especially asthma, COPD, emphysema, any respiratory infection. When we are performing the assessment, we are checking and seeing if there's any extra sounds. Some of those sounds can tell us that they are having some symptoms of shortness of breath, increase work of breathing,
Okay.
also increase respiration rate. So how quick you breathe.
Oh, okay.
So what we are going to do today is I'm going to listen to your front, and then I'm going to listen to your back, and then I'm going to do a couple of new techniques on you that I found in studying. Are you ready?
Sure.
All right. All right. All right. Take a deep breath. All right. Excuse my hand. Excuse my hand. And one more. All right. All right. Now I'm going to listen to your back.
Okay.
Stand up. All right. I'm going to have you kind of face this way a little
Okay.
bit for me. Just a little bit more. All right, perfect. All right, take a deep breath. Good. So you are sounding nice and clear right now. So clear means no extra sounds.
Okay.
All right, I'm gonna have you still stay there. Sorry about that. All right. So what I'm gonna do is I'm gonna put my hands on your back,
Okay.
and then I'm gonna have you take a deep breath for me. All right. So this just allows me to see if there's any differences in your when you take that deep breath. If there's different size. So a lot of times when somebody their lungs are a little bit up versus the other one, we can show early signs of pneumonia. Also, we can show that there is something abnormal like collapsed lung.
Oh wow.
Yeah. I also are gonna just go ahead and touch around your back. So what I'm doing is just making sure that I don't feel any extra. Um, it's called air. It would show early signs of infection. And then I'm just gonna palpate a little bit.
Like bronchitis or pneumonia?
Um, Early signs of that, like more of like emphysema, which is a lung condition.
Okay.
All right, so we can go ahead and turn back around. All right, another technique that we do is I'm going to have you take a nice deep breath for me, and you're going to count to 10. So take that deep breath for me. Release, and now count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. So what that is doing is making sure that you are still breathing effectively after counting. After counting, a lot of people can't get all the way down to 2 or 3 if they're having really respiratory distress or having signs of COPD or emphysema. So you'll see them kind of pause and start breathing really, really heavy or can't complete. Another thing that we like to do is just to see if a little history about you, to see if your breathing is affecting your everyday life. Any difficulty going up a lot of stairs? No. Good. And then also we like to do something new questionnaire about some of your history. It's called soft mash. So each thing means just an assessment.
Okay.
So any symptoms, shortness of breath, increased heart rate, increased breathing.
No, unless I really, really exercise.
Okay. What is your occupational right now?
I'm an X-ray tech.
Any exposure to smoke, fire, anything that would upset your lungs?
No, it's pretty clean in there.
Okay. Any family history of asthma, COPD, emphysema?
Yes, my sister has asthma, and my great uncle had COPD really bad.
Okay. Any triggers and treatments? Some symptoms if you're exposed to like fire and you can't breathe, or in the environment.
No, not really any environmental stuff.
Medications, any medications that you have been prescribed, or any use of drugs.
The only thing I've ever been prescribed was an inhaler.
Okay.
It's only when I was super sick with like an upper respiratory infection, and then they gave me an inhaler to use with it.
Do you know what type of inhaler they gave you?
They gave me that inhaler that you kind of push and then like breathe in real deep and hold it in and then blow it all out.
Okay. Any allergies or activities that make your breathing difficulty?
No, unless I exercise too hard.
Okay. Not allergic to any pollens or anything?
No, not that I'm aware of.
Okay. Any smoking history or exposure of smoking?
I don't smoke. My dad smoked for 20 years, but he currently quit, so he's good with that.
And any history of respiratory illnesses or reoccurring hospitalizations?
The only thing I've ever had respiratory wise is when I was a baby. I was actually came out a little blue, had the umbilical cord wrapped around my neck. I spent 3 days in the NICU with oxygen in the nose.
Yeah, that would be respiratory distress in infancy. But nothing current.
No, I only had to use that inhaler one time when I was really sick.
All right, well, that is it for my respiratory assessment. Any questions or concerns for me?
No, I'm good.
All right, well, thank you for spending the time with me today.
Oh, you're welcome.